right, everybody, there is still time to improve your smile before all the holiday pictures if you make an appointment at the Aesthetic Associate Center. Dr. Todd Shatkin is back to show what can be done with the modern dentistry methods that are used there. Good morning.
Good morning.
How
good morning.
are you?
It's great to be here, Linda.
Thank you. It's nice to have you back.
I'm doing well.
And there's a lot that you can do, and in a short amount of time. We were talking just before we came back on the air about veneers and how you've been doing veneers for a long time. That
yeah,
really
porcelain veneers are fantastic. It's quick. It can be done in 2 visits. You can use them to close up spaces that they don't like, if there's spaces between their teeth, if they're discolored, if they have chips on the edges of the teeth. You can use it for a whole bunch of things, and it can really dramatically change somebody's smile in a very short period of time. You
know how people sometimes have the staining due to, what is that drug that they take?
Tetracycline.
Yeah, can you put a veneer over that?
Yeah, so tetracycline or minocycline, people they call it minicin. If you were on antibiotics as a child for bad acne, bad skin, sometimes the teeth get discolored.
Yeah.
And even if your mother took it when she was pregnant, sometimes that transfers over into the bone and things. So the veneers can camouflage that very nicely. Teeth whitening can help to a certain extent, but not a lot with the tetracycline stain. You need to really put something over the teeth to camouflage that. Okay. So we do that quite a bit on those patients as well.
That's a wonderful way to, because a lot of people will be self-conscious of that for their whole life.
Yeah, it definitely makes a difference.
But let's talk about if you don't have those problems, holiday whitening, you can do that. If you want to look a little brighter in those pictures.
Yeah, we do the glow whitening. I brought it on one time. I could do that again. The glow whitening program is fantastic. It's a in-office treatment, then a home whitening kit, which is really fun. It's got that light-up tray that lights up in your mouth, and you do it 8 minutes a day to keep your teeth white once you do the in-office treatment. And we're offering a holiday special for anybody out there that wants a whitening. They'll save $100 all the way through New Year's Day.
See, now that's a great gift for someone when you know if that's what somebody really wants.
Yeah, and if you want, they can buy a certificate for that as well. So instead of $4.95, it's $3.95 all the way through New Year's.
Okay. You always come bringing some cases, and I know you want to let people know that this first one can be a little severe.
Well, it's the second one. The first one's not bad. The first one is going to be the veneer patient, and that's what I was talking about. Somebody who has some spaces, discoloration, and really wants to just improve their smile. This is a gentleman who wanted to make his teeth look a little bit bigger, a little bit nicer, and so we did veneers on his 6 front teeth and made them whiter, closed up those spaces, and made
That's
them
amazing.
Nice.
You completely changed his smile.
Yeah.
Wow.
And these are like a thin, it's almost like a false fingernail for your tooth, but it's very, very thin. If you hold it up to the light before it's cemented, you see right through it. So it's very, very ultra thin. And the next case is a little bit difficult it may be a little difficult for some people to look at. This is somebody who really neglected their teeth on the left there, and the teeth were in really bad shape. The upper, we did a temporary bridge on top. The lower, we show the before and after the extraction with permanent implants and a permanent porcelain bridge on the bottom. So that can be done in a matter of probably 2 or 3 visits, dramatically changing somebody's life really when they can't eat, they've got teeth pain and gum pain and all that stuff.
And you know, it's just another opportunity to let people know you have seen it all. Don't be afraid to call because you'll say, oh, my teeth are in such bad shape, I'm embarrassed to go.
Well, I wanted to show that because most people are not that bad.
No.
So if you have 1 or 2 bad teeth, don't be embarrassed to go to the dentist, get them checked out and get them fixed. So many people, like you said, come in and say, I don't even want to show you my mouth. It's the worst you've ever seen. And I say, no, I promise you it's not the worst.
Yeah.
You know.
And look at what you were able to do. And again, a small amount of time, 2 or 3 visits.
Yeah. And with that particular patient, we did IV sedation. Dr. Birkin came in, gave him an IV. We sedated the patient so they didn't feel anything. We took the teeth out, put all the implants in at the same visit, put a temporary bridge in her, and then 2 weeks, 3 weeks later, she got her permanent
she must be thrilled.
teeth. Yeah.
Must absolutely be thrilled.
Really happy.
And that's, you know, that's great because you do offer the sedation. A lot of people, unfortunately, let their teeth get to that point because they're afraid.
Yeah.
So you can deal with that. You don't have to worry about even being awake for the procedure if that bothers you.
It's so important to if you're going to get sedation in a dental office, that it's done safely. Because I can't harp on this enough, because so many people offer sedation dentistry, but you've got to make sure that the doctors are trained in proper use of the sedation techniques. And what I choose to do in my office, rather than doing the sedation myself, is I have Dr. Rose Birkin, an anesthesiologist, MD, come in and do the sedation for us. So I don't have to think about the safety. I know that the patient's going to be safe.
Yeah, and that's going to make you fall asleep a little bit easier too.
Yeah.
You know, knowing that everything is going to be taken care of, and then you wake up and the work is done.
Yeah.
I can only imagine how many people out there would love to have that for a holiday gift. You can do it. You really can. Yeah. And don't forget, it makes such a difference in your health. Your oral health is just a mirror of the regular health in your whole system. Go and get yourself taken care of. Dr. Todd Shatkin is waiting for you with the wonderful staff at the
free consultation.
Okay, the Aesthetic Associates Center, and he'll also offer a free consultation. There's a gift right there. They're located at 2500 Kensington Avenue. Please call right now, 839-1700. To find out more, go on to greatlook.com.